What's up, everyone? This is Dr. Webb here. On this video, I'm going to be discussing some and giving some tips on medical students' transition to intern year. As you all know, July 1st is when new medical students start at the hospital. They become interns and start their residency. It's been said that lots of different mistakes and happened during this time when that transition in July, and a lot of different memes online that state do not go to the hospital or get sick around July, August when the new interns are there. Personally, when I started my intern year, I didn't know what was going on. I was completely confused, walking around like a chicken with his head cut off. I even questioned myself, reason why I went into medicine, because I had 3 pagers on me. I was getting calls from the nurse on the floor. A patient was sick downstairs in the ER. I had patients calling the patient line saying they were in pain. And I was like, what the hell did I get into? And I was actually kind of depressed at some point early in my intern year, because I thought that the whole residency was going to be like that. But it gets better every year. Currently going into my 4th year of orthopedic surgery training, and like I said, it does get better. Some tips for you guys who are starting off, your recent graduates, MD behind your name. You're going to be wearing your white coat. It's going to be the freshest that it will ever be during your residency training. I can always tell new medical students, new interns, because they have the freshest white coats in the hospital. White coats are ironed, they're crisp, they're fresh. They look like they've been on vacation for the last few weeks. They look like they've been relaxed. But it's time to get busy, July 1st. So some things for you guys. Number one, I want you guys to understand that you are prepared. Everything that you learned in medical school will come back again. You already have the knowledge base. You just need to put it into a clinical situation. There are going to be times where you feel stress or you don't feel like you know the correct answer, but one of my senior residents once told me that if you don't know the answer, always check with the nurses, because they've been doing this for some 10, 20. I met a nurse the other day who's been doing this for 30 years. So just ask your nurse. If she asks you, hey, the patient's blood pressure is 80 over 50, what do you want to do? Ask the nurse, hey, what would you do normally in this situation? I would give 2 liters of fluids. You know, if the patient's blood pressure still doesn't come up, we can get a central line or art line in. So just check with your nurses and be nice to them. Always be on time. You don't want to be late for anything. Make sure your pager works. Make sure you have battery on your cell phone that's charged, because you will be looking up a lot of things on your phone, different medications. There is a green textbook that a medicine pocket book that I would recommend. If I find it, I'll put a picture in the video. This was very helpful for me, because I just flipped through the book when a patient came in with cholecystitis. This is how you work them up. This is what labs you get. You want to get this imaging test, ultrasound or CT scan. So I thought that book was very helpful. Ask for help. You're new in the hospital. You got people, your senior residents. Don't be afraid to ask for help, because there's people always that are not going to always be immediately present, but make a phone call if you don't feel comfortable performing a procedure, or you don't know what medication to give. Just always ask for help. And I see a lot of people get into trouble when they try to oh, I'm a doctor now, I got this, and be overly confident, but you can actually kill a patient. So just be careful, ask for help. Know that you are very prepared. You've been taught all this information in medical school. You just have to regurgitate it in the clinical situation. But intern year is a great year. It's definitely a transition. You have to take each day with a grain of salt. Take it day by day, and just try to get better each day. Continuously to read. Don't forget that you always have to read, even though you may work 70 hours a week, 80 hours a week during your intern year. You have to read. Make sure that you have some work-life balance, and you have to find that balance early on in your training, whether that's working out with your friends or spending time with your family. All of that is important. So those are my tips for you guys. Residency is very challenging, but it's very doable. The transition is a little bit rough, but the first time that you go introduce yourself to a patient and say that, hey, I'm Dr. Webb, that's probably the greatest feeling. And I think you guys worked to this point and got to this point, and I think all your hard work is going to pay off here shortly. Any more questions, email me at overcomingtheoddsbook@gmail.com or hit me up on my website, AntonioWebbMD.com. Thank you, and see you next time.